All right, you know that feeling, right? Your browser has like a dozen tabs open, your desk is maybe buried under articles, and your read later list is just out of control.
Hmm.
You're trying to get a handle on some important health information, but it feels less like learning and more like, I don't know, drinking from a fire hose.
It really does. It's a familiar and honestly pretty frustrating feeling sometimes.
Yeah. You just wish someone could like cut through all that noise and just show you what actually matters.
The sheer amount of information, especially about something as vital as health, it can be genuinely overwhelming.
Absolutely. And that's
Yeah.
exactly why we're diving deep today. Our mission really is to be your guides through this huge world of health information.
We've gathered a pretty significant stack of sources,
Mhm.
articles, research, key insights from really diverse, reputable health organizations, government bodies.
And we're going to try and distill it all down for you.
Yeah, the goal for this deep dive is basically to give you a shortcut, a way to be truly well-informed.
We'll unpack where reliable health info comes from, how these big organizations actually organize it, which is fascinating in itself.
And crucially, what core insights keep popping up again and again across different platforms. The really important stuff.
Think of it as your personalized guided tour. We're not just telling you what's out there, but how it's structured.
And maybe most importantly, how all this complex medical knowledge gets simplified for you, the person just looking for clear, usable answers.
Exactly. And as we dig in, I think you'll start to see some surprisingly consistent patterns emerge. It's quite interesting.
Definitely.
So if we're doing this guided tour through the health info landscape, where do we even start?
Well, we absolutely have to begin with trust. That's the foundation.
Right. Because when you're looking up symptoms or treatments, how do you even know you're getting good data and not just, well, more noise?
This is so critical, and every major health organization really emphasizes trustworthy sources. One of the clearest signals, especially in the US, is the website domain itself.
You mean like the .gov?
Exactly.
Yeah.
Official government websites consistently end in .gov or .mil. It's like an instant signal of authority.
Okay. And it's not just the domain, is it? They also talk about the HTTPS bit, and sometimes there's that little lock icon.
hmm
I always assumed that was for like online shopping security, but what's it mean here?
It means your connection is secure, basically.
Mm-hmm.
Any data you send or even just view is encrypted,
Yeah.
private, protected.
Okay.
Organizations like the U.S. Department of Health and Human Services, HHS,
Mm-hmm.
or the National Institute of Mental Health, NIMH,
Yeah.
and the National Institute on Aging, NIA, they all consistently point these things out. They're trying to build that immediate sense of confidence in the information.
Got it. So, okay, we've checked the address, the connection's secure. But even with trustworthy sources, you're still facing this like mountain of information.
hmm
How do these organizations actually structure it all so it's usable? So it's not just a giant messy list.
That's where their approach gets really smart. We've noticed about 5 core categories that pop up again and again. Almost all these organizations use them.
5 categories. Okay.
Think of them as the main pillars holding up the whole structure. Makes it navigable.
So what's pillar number 1? The one most people probably think of first.
The broadest one, and maybe the most intuitive, is health conditions and diseases. The what's wrong section.
Right.
It covers over 1,000 diagnoses, illnesses, disorders, everything from cancer, heart disease, stroke, diabetes,
Mental health issues.
definitely. Mental health and mental disorders are huge.
Hmm.
Infectious diseases, autoimmune conditions. By listing all these, they're essentially mapping out people's most common worries and immediate needs.
That makes sense. It's often the problem that drives you to look for info in the first place.
Exactly. It's a direct response to why people are searching.
Okay, so that's the conditions. What's the next pillar about? Is it more positive?
It shifts focus, yeah, from reactive to proactive. Pillar 2 is health behaviors and healthy living.
The stuff we can do.
Precisely. It focuses on the choices you can make to stay well. Prevent illness, we're talking. Healthy eating, physical activity, sleep,
Nutrition, vaccines.
yep, nutrition, vaccination, even stress management. It's about empowering you with the daily tools for health.
Okay, that's crucial. Now, I've definitely noticed that a lot of sources tailor information. Is that one of the ways they organize things?
It absolutely is.
Yeah.
The third category is population groups.
Like kids versus older adults.
Exactly. Health information is often specifically geared towards different demographics because, well, health needs change, right?
Sure.
So you'll find dedicated sections for children, adolescents or teens, women, men, older adults, and even people with disabilities. It ensures the advice actually feels relevant to your life stage.
That's smart. Yeah, a teenager's health concerns are totally different from someone, say, over 65.
Right.
Okay, so what are the last two categories? We've got conditions, behaviors, populations. What else shapes health?
The fourth is settings and systems. This one looks broader at the environmental and sort of infrastructural factors influencing health.
Like where you live or the healthcare system itself.
Exactly. Topics like environmental health, healthcare access and quality, health insurance, the overall public health infrastructure. It's the where and how health happens beyond just the individual,
Yeah.
the bigger picture.
Right, the context. And then there's that one we hear more and more about now, the social side of things.
Indeed. The fifth, and I think increasingly critical category, is social determinants of health, SDOH.
SDOH.
And this is such a powerful insight. These are the non-medical factors that have a huge influence on health outcomes.
Like income, education.
Yep, economic stability,
Yeah.
education access and quality, your neighborhood and built environment, your social and community context. All these things.
Wow.
They can significantly impact your health, sometimes even more than your healthcare choices or individual behaviors. It's profound.
Wow. Yeah, when you lay it out like that, it really does expand the definition of health way beyond just a diagnosis or, eating your vegetables.
Right.
It shows how interconnected everything is. That's actually a really powerful takeaway. Okay, so across all these categories, all these topics, what are the greatest hits? The ones that just keep showing up everywhere.
Oh, there are definitely some clear frontrunners. The ones that signal, broad importance and major public health impact.
Like the big chronic diseases.
Absolutely. You'll almost always find detailed information on cancer, heart disease, and stroke and diabetes. Sadly, they're just very widespread and impactful.
It feels like mental health has really stepped into the spotlight more in recent years. Did the sources reflect that? Is it up there with heart disease or cancer?
Oh, completely. Mental health and mental disorders are consistently highlighted,
Yeah.
often with their own dedicated, extensive sections. It's right up there.
Okay, good.
Similarly, infectious diseases and STIs are always covered. Everything from HIV, AIDS, HPV, that's human papillomavirus,
Right, HPV.
to chlamydia, gonorrhea, and of course more recent things like COVID-19 and Mpox. They have to cover those.
Makes sense. And what about the everyday lifestyle stuff? The things people think about for just, day-to-day health?
Nutrition and healthy eating, definitely. Plus, physical activity or exercise, those are universal.
Everyone talks about those.
Everyone. Vaccination is always there too, obviously, for its role in prevention.
Sure.
Other really frequent ones include chronic pain, obesity and weight management, and pregnancy and childbirth. These are really the core health concerns that these sources can consistently try to inform you about.
Okay. That gives us a really clear picture of the main players. So, moving beyond just the topics and categories, what are some of the deeper themes, the sort of big picture messages these sources keep emphasizing?
Well, a major one, and I'd argue probably the most empowering insight, is this really strong, proactive focus on prevention and healthy lifestyles.
Ah, okay. Not just fixing problems, but stopping them before they start.
Exactly. It's a fundamental shift in public health thinking, from just reactive treatment to proactive wellness. It's about giving you the tools to potentially avoid problems altogether.
That's a really powerful message, and maybe one we overlook when we're just searching for a quick fix for something.
Mm-hmm.
Can you give us some specific examples? Like, what are they actually telling us to do?
Sure. So, diet and exercise, obviously. Sources like Bupa UK talk about a balanced and varied diet. Pretty standard advice. And even a student support service like UC Louvain suggests a minimum 30 minutes daily physical activity.
30 minutes a day. Sounds simple, right? But,
But actually doing it is another thing. Still, it's remarkably consistent advice across very different organizations.
okay. What about vaccinations? Always a hot topic.
Vaccinations are consistently pushed as a key preventive tool. And the recommendations evolve.
Like boosters.
Yeah, like regular booster recommendations for diphtheria, tetanus, or pertussis,
Hmm.
especially if you're active outdoors or in certain jobs. HPV is another big one.
Right, the cancer prevention aspect.
Exactly. It protects against various cancers, genital warts. And it's interesting, it was initially mostly for girls and young women, but now it's also recommended for boys and men too, though cost and coverage can still vary.
Mm-hmm.
Hepatitis B is also mentioned, sometimes even compulsory for certain students, like in hospital settings.
And mental well-being fits into this healthy lifestyle picture too, right? It's not just physical.
Absolutely. It's
Yeah.
very holistic. Sources like Healthline, the American Heart Association, they highlight healthy sleep, stress management,
And IMH too.
and IMH, yeah, the National Institute of Mental Health, has specific guidance on caring for your mental health, coping with traumatic events. It recognizes mental health is just as vital as physical.
Okay. Now, you mentioned earlier how info gets tailored for different age groups. Is there a specific name for that approach?
Yes, it's often called the life course approach.
Life course approach. Okay.
It basically means adapting health information for different life stages, recognizing that our needs and challenges change as we go through life. It's about relevance.
Can you give an example of how that actually looks?
Sure. Nimmer's Kids Health, for instance. Their site has totally separate sections for kids, for parents, and for teenagers. The content is different. The tone is different.
Tailored for each group.
Exactly, covering body functions, illnesses, emotional stuff, all geared towards that specific age. And then on the other end, you have the National Institute on Aging, NIA, focusing solely on healthy aging, conditions common in older adults.
So it's about getting the right info at the right time in your life.
Precisely.
Yeah.
Very user-centric.
That makes a lot of sense. And speaking of relevance for everyone, there seems to be a strong theme about fairness and access too, right? Beyond just individual choices.
There is, and it's a really critical one, addressing health disparities and equity.
Equity, yeah.
Initiatives like Healthy People 2030, organizations like the American Public Health Association, APHA, they're deeply committed to improving health for everyone, actively trying to remove barriers.
So it's not just about putting the information out there, but making sure everyone actually has a fair chance at being healthy, regardless of background.
Exactly. And that includes a big focus on those social determinants of health, the SDOH we talked about earlier.
Right, the non-medical factor.
Yeah. APHA explicitly states that public health efforts to prevent disease are more cost-effective and humane than treating chronic health conditions.
Wow, that's a powerful statement. Cost-effective and humane.
It really is. It's a strong argument for prioritizing prevention and ensuring everyone has equitable access.
Yeah,
Because ultimately, it benefits all of society.
that's a really profound point. Okay, let's shift gears slightly to some important nuances. And the first one seems absolutely crucial, that line between the information they provide and actual medical advice.
Yes, this comes up constantly in the disclaimers,
You see it everywhere.
and for very good reason.
Yeah.
Sources like the Office on Women's Health, OWH, and NIMH, they have these really clear disclaimers. They state up front they do not see patients. They explicitly say they're unable to diagnose your medical condition, provide treatment, prescribe medication, or refer you to specialists.
So basically, we're not your doctor.
Pretty much. Their role is to inform and educate, not to practice medicine on you through a website.
Which makes total sense. It's about empowering you with knowledge, but not pretending to be your physician.
Precisely. They're information resources, understanding hubs, not direct medical providers. And that's why you almost always see that critical reminder.
Call 911.
Yeah, please call 911 or go to the nearest emergency room if you are experiencing a medical emergency.
Yeah.
They want you informed, but they absolutely want you to get professional help when you need it. It's a really important balance.
That distinction is so important to remember. Okay, next nuance. Health science changes constantly. How do these organizations keep all this information up to date? It must be a huge job.
It is a massive undertaking, and it really highlights how dynamic this field is. This isn't static information. Medline Plus, for instance, explicitly says its health topics are regularly reviewed and links are updated daily.
Daily. Wow.
Daily updates on the links. It's a staggering amount of ongoing work just to maintain accuracy and relevance.
Daily link updates. That's impressive. Do we see any specific dates in the sources that kind of illustrate this constant evolution?
Yeah, we do. The sources give us some recent snapshots. For example, back on December 5, 2024, the Office of Disease Prevention and Health Promotion announced new infographics for Healthy People 2030's leading health indicators.
Okay, so updating how they present the data.
Exactly. Tracking major causes of death, disease, social determinants across life stages, continuously finding better ways to show that data.
And there was that interesting update related to a court order recently, too. That shows how other factors can play in.
That's right. A specific page on the HHS website related to Healthy People 2030 objectives was restored on February 14, 2025 at 11:59 p.m. ET because of a court order.
Right.
And that restoration included a disclaimer from the Trump administration regarding gender ideology. And we're just reporting what the source says here.
Right. Impartiality is key.
But it illustrates how public health information, while aiming for neutrality, can sometimes be impacted by external legal or political directives. The organizations just reflect the content they're required to host.
Understood.
And just one more quick example of routine updates. The Office on Women's Health's main AZ Health Topics page shows it was last updated April 9, 2025. It just shows the constant, diligent work happening behind the scenes.
Yeah, it really does pull back the curtain on that effort. Okay, finally, beyond those 5 big categories we discussed, how do these sources make it practical to actually find what you're looking for in this sea of info?
Well, beyond the broad categories, many directories like Medline Plus and the MSD Manual get more granular. They often organize information by specific body systems.
Ah, like chapters in a biology book.
Kind of. So you can browse topics specifically related to, say, blood, heart, and circulation, or brain and nerves, or bones, joints, and muscles. It helps you zero in much faster, like a specialized library section.
That makes sense. And it's not just about diseases or conditions, right? They include safety stuff, too.
Exactly. You'll also find really important topics under headings like emergency preparedness and safety. Things like first aid, fire safety, motor vehicle safety, water
And
safety.
it's tactical, preventative stuff.
Yeah, stuff to empower you for unforeseen situations and injury prevention. And it's a vital, sometimes overlooked part of overall public health. Being prepared, not just treated after the fact.
Well, we have definitely covered a lot of ground today.
Hmm.
We started by hitting hard on the need for trustworthy info, looking for those .gov sites, the secure connections, as that first essential filter.
Then we unpack those 5 core categories that consistently structure health knowledge from specific conditions and healthy behaviors.
For population groups, the settings and systems around us, and those crucial social determinants of health.
Right. We also highlighted the greatest hits, the topics like cancer, heart disease, mental health, nutrition that these organizations prioritize.
And those key underlying themes, that powerful emphasis on prevention and healthy lifestyles.
The life course approach, adapting info for different ages.
And the really important ongoing work to address health disparities and achieve equity, making health fair.
And let's not forget that vital distinction. This is information, not personal medical advice.
Official disclaimer. And we also got a peek behind the curtain at how this info is constantly updated, daily in some cases.
And practically organized, whether by body system or safety topic, just to help you navigate it all.
Knowing where to find reliable health information and, just as importantly, understanding how it's organized, that really is a powerful tool.
It absolutely is. It shifts you from feeling overwhelmed by that fire hose of data to feeling more empowered, more confident in your search for health knowledge.
So, as we wrap up this deep dive, here's something to think about. Given how health understanding is always evolving and how information itself is shared is always changing, how might your approach to staying informed need to adapt? How can you make sure you're always getting the most relevant, most reliable insights for your own well-being? What new habits or filters might you need to put in place?